My name is Dr. Joseph Shapiro. I'm a behavioral optometrist and optimist. I'm also the director of the Center for Unlimited Vision in New York City, which is a vision therapy center. My center deals with complex visual problems that commonly and unfortunately go undetected, misdiagnosed, or dismissed as being irrelevant. What's even worse is that there's an epidemic of these types of visual problems, and countless people, children and grown-ups alike, are needlessly suffering from visual problems that are affecting not only their eyes, but their body and state of mind as well. Head tilt, shoulder slumps, curved spines, facials, neck and shoulder tension can be caused directly by visual problems. Fatigue. 33% of our bodily energy is used up in the process of seeing when vision is normal. When it's not working efficiently, I've seen estimates up to 70%. Digestive problems. How does that fit into the picture? Think about it this way. If you put on someone else's eyeglasses, you may get momentarily sick to your stomach. Dizziness. Vision is the biggest part of the vestibular system, which is the balance system of the body. So if you're suffering from dizziness, the visual component can be significant in that whole process. Car sickness or motion sickness and so forth. Anxiety. Big problem today. I have one patient that tells me she's being treated by a psychiatrist for depression and anxiety. Depression, she says, logically, she knows why she's depressed. There's no logical reason why she's anxious. But when she takes off her glasses off, her anxiety goes away. When she puts them back on, her anxiety reappears. I have many patients who prefer walking around without their eyeglasses because their mind shuts up, their bodies relax, they feel more expansive, their peripheral vision opens up, even though they're walking around in the midst of blur. I have helped countless people with concentration problems that also have visual problems. That's a big problem today. Phobias. Some forms of phobias have visual components, disturbed feelings in crowds, overwhelmed by visual stimulation, looking at things and feel like it's confrontational, just looking at different objects in the environment. Going in supermarkets or department stores and getting overwhelmed easily. If you have difficulty with heights, that can also be a visual problem. Headaches. Chief cause of headaches is eye strain of various kinds, even migraine headaches. I've been very successful in helping people get rid of their headaches. ADD, reading disabilities, attention deficit disorders, as I said, are very amenable to treatment by these types of techniques that we use here at the center. In addition to the systemic and psychological effects of these type of visual problems, we have the eye strain, pain in and around the eyes, pressure buildup, one eye feels like it's doing more work than the other. We have double vision, periods of double vision. We have vision going in and out of focus, light sensitivity, and our eyesight is getting worse and no one knows how to stop it. We go from eye doctor to eye doctor, getting different pairs of glasses, a little tweak this way, a little bit that way, stronger lenses, and we still walk out with the same problems. We're referred to neurologists and psychologists and psychiatrists. We go for MRIs, CAT scans, and a whole host of tests, or even to an internist to get medications to cover up our symptoms. Why, you may ask, do these problems go undetected, misdiagnosed, or ignored? And the answer is very simple. The medical eye care system today is broken. It is based upon an antiquated mode of visual analysis, the ultimate goal of which is to achieve 20/20. If you can read the bottom line of an eye chart at a distance from 20 feet away, one eye at a time, sitting in a dimly illuminated room, sitting in a chair, immobilized, and you can read that, you're said to have perfect vision. That's an absolute myth, and it's one of the biggest medical frauds ever perpetrated on the public. No single statement has done more to undermine your visual welfare. 20/20 is a small fraction of your total vision. It doesn't take into account eye movement, eye coordination, depth perception, eye muscle strength, focusing power, peripheral awareness, a host of other skills. Everyone needs a functional vision analysis to evaluate all their visual skills that go beyond 20/20 and see how they interact with each other and interact with our eyesight at the same time. You owe it to yourselves and to your families to have this type of evaluation. I hope I've opened your eyes to looking at vision in a more global way. And thank you for listening to me today, and have a great day.